In this video, I'm going to talk about chronic sleep deprivation. And chronic sleep deprivation mimics so many diseases. It's unbelievable, actually. And I wanted to create this video so that some of you, it might be of some help to you guys. Um, chronic sleep deprivation wrecks your so many system in your body that you will be surprised what I'm gonna talk about today. So please go through the whole video and ask questions and comments, because the more we talk about it, there's a more awareness about it, and it's gonna benefit some folks. So even it helps few people, I'm happy that it's gonna help few people. So, chronic sleep deprivation is much more than feeling tired. When the brain and the body are deprived of restorative sleep for weeks or months. I just saw a patient who was a young man in his 30s, and he had been taking care of his full blown autistic disorder of his child who was 8 years old, and he had been taking care of him. I could tell him that he had sleep deprived. So sleep deprivation, where you don't have restorative sleep, if the effects accumulate and often mimic other medical and psychiatric conditions, making it easy to miss the real culprit. So I'm just going to break down system-wise so that you can understand different system. We're going to have different kind of manifestations. So just be patient, hang in there. So cognitive and mental symptoms. So you're going to have poor concentration. You're going to have memory lapses. You're going to have a brain fog. You're going to have slow reaction time and reduced alertness, right? You're going to be irritable. You're going to have mood swing. You're going to have anxiety, depression-like symptoms. And you're going to have a reduced problem solving and decision-making ability. So here you go. Those symptoms can mimic so many of psychiatric condition, right? Physical symptoms: constant fatigue, low energy despite rest, headache, dizziness, blurred vision. You're gonna feel hungry. You're gonna feel hungry because the lack of sleep increases the level of ghrelin, the hormone, hunger hormone, and that particularly you have a cravings for carbs and sugar. So lack of sleep would make you want more to eat sweet. It could be any sweet, anything sweet, anything sugary would help, and that you become addicted to it slowly. Hormonal changes, the cortisol level, the ghrelin level, the leptin imbalances, and insulin level, everything gets out of order, and that affects your metabolism. You have weakened immune system. You have frequent cold, and infection. Sometimes you feel like you got a flu-like symptoms that never go away, or you have symptoms of allergies, stuffy nose, runny nose, congestion in sinuses, and it has behavioral and functional impact. Like you're going to have micro sleeps or micro narcolepsy, where you are so sleepy that you cannot stop it. You're going to have to pull over your car or take a nap for 10-15 minutes, or just sleep in your sofa, or do whatever you can to have a micro sleep. You have a reduced motivation. You are unproductive at work, at home. You have poor coordination, and you have, then you also have impaired judgment. You can't make decision, and your risk taking in behaviors go up. Other mimicry it plays is this, like depression and anxiety. So sleep deprived people often feel persistently sad, hopeless, irritable, and panicky. ADHD and attention disorder, impaired focus, distractibility, and restlessness, dementia and cognitive decline, memory gaps, confusion, poor execution of function, somebody who don't like you, they can say, hey, you're developing dementia or something. What's going on with you? You're losing it. So those kind of comments gonna be thrown at you. Endocrine and metabolic disorder. Now, because of what I said earlier, insulin gets disturbed, leptin, ghrelin, cortisol. So insulin resistance and weight gain is very common. And then you have increased risk of diabetes. You develop chronic fatigue syndrome because there's an unrelenting tiredness and muscle aches and low stamina. It's like, what's going on with me? I have a lady, I'm doing workup on her. She's 37-year-old. I've already diagnosed her, but all the tests so far I've done has been negative. And I told her that you have sleep deprivation because she has symptoms of narcolepsy. So you can mimic chronic fatigue syndrome. It can mimic fibromyalgia, because a lack of sleep, excessive sweet intake, and the change in the hormone in your body, you have a heightened pain sensitivity, muscle tension, and non-restorative sleep. They all mimic fibromyalgia, chronic pain syndrome. Okay? Cardiac and hypertensive illnesses, elevated blood pressure, arrhythmia, heart disease risk goes up. Neurological disorder like mimicry goes on, like multiple sclerosis and Parkinson's. You have fatigue, you have slow movements, you have tremors sometimes because there's a severe loss of sleep. People who are sleep deprived, they're at high risk actually for substance abuse like alcohol or smoking, and of course excessive sugar intake and things like that. So the key point I wanted to make is that sleep deprivation affects nearly every system of your body: brain, hormone, immunity, heart, metabolism. It creates a chameleon effect, making it look like depression, anxiety, thyroid problem, diabetes, metabolic disorder, even dementia, or all kind of stuff. So that's why it's really important that sleep history is essential. I make it a point, and I just want to make sure that you are sleeping okay. And it's more common when people tell me that they don't have enough sleep. So get a good sleep, and instead of using chemical, use ashwagandha. Dr. PK Life has ashwagandha complex on Walmart online, and it's a highly rated my product there. That's my first product I brought in the market 2 years ago. It's like almost 5-star rating, all of them, and 90-day supply for $35. And you take 2 capsules. It's extremely effective. But if you can find anything else, try something. But you got to have good sleep. You got to have good sleep. Sleep is important. Thank you very much for watching.